I've seen doctors draw up before on a board or just describe what it looks like. And if the court thinks I open the door, then certainly you can allow it.
Why are we calling the doctor?
I'm not sure why we're calling him. I don't think I have much for cross-examination. We've offered to stipulate.
I'm just trying to understand the doctor who can testify that she died from strangulation.
There's other issues as well.
As long as the defense agrees she died from strangulation, do you need this?
It's fairly significant because the blood vessel burst as a result of the pressure based on the neck. Yes. I think I don't care. I think I'm entitled to prove how she died, and she died from blood vessels bursting, among other things. All right.
It's actually, you keep calling it a retainer. It's a bike plate, a night guard bike plate?
We've never called it a night guard, contrary to what the defense said in opening. So. I'll take it.
All right, bring it in. Mr. Allen, I assume the first question you asked challenging the doctor and the cause of death, I picked your opinion.
I understand your well one.
You know, you see,
Mr. Schneck, the defense attorney talked to you about bias because the police gave you information about combo number 4. But you didn't find all the specific ingredients that they thought you were going to find, did you?
No, I did not.
All right. Do you know whether Nicole substituted beans for the meat in the crisp taco?
No, I did not.
Do you know if she ate everything in her combo?
No, I did not know.
Do you ever take into account that some people may have intestinal problems that are aggravated by certain foods?
Well, I don't take it into account in terms of analysis.
Right. What you find is what you find.
Fine is what you find.
Now, you testified also, and you need to clarify this, that you bought a crisp taco with beans, right?
Yes.
And in your report, do you have a copy of your report with you? Could you take a look at the bottom of, second paragraph where you talk about the meal containing the right?
Correct. They're just actually the ingredient of a soft shell taco,
Okay.
unaltered at all before it's placed in the stomach by digestive processes.
Okay, so you took a soft burrito shell and a crisp burrito shell and you put it under a microscope. You didn't chew those before you photographed them,
That's correct.
right? And in your report, you said pieces of taco shell probably would not be identified in the stomach, right?
That's correct.
So the clumps that counsel was asking about in Nicole's stomach really have nothing to do with those photos. Is that right?
That's very true, yes.
I'd also like to hand you State's Exhibit 116. I showed you this earlier this morning. And I believe that you identified that as the sequence of photos that you took over the course of the examination.
Yes, it is.
Is that correct?
Yes.
Counsel talked about the few slides that were shown that showed consistencies among the foods. I want to ask you, were there many other things that were consistent that I didn't show on the PowerPoint?
Yes, there were actually. If you examine the pinto beans microscopically using a polarizing light microscope, the cell structure at high magnification is also very similar, showing the cell walls. And what we're looking at are similarities and differences between cell walls from various foods and items of evidence. In this particular case, the cell walls have a very similar two-layered cell structure, similar widths of the cell walls, and also the structures of the bean cotyledons, which are encapsulated with the starch inside. They have similar shapes too.
Okay, and how about the yellow tubular structures that are depicted in those photos?
Yes, by electron microscopy, they also show similar structures.
And what do you think that is?
Well, the yellow bell pepper skin.
Okay. And what about the red peppers?
The red peppers, I do have images of red peppers, or chili pepper, by polarizing light microscopy.
Okay. I'd like to offer 118.
May I take a look at it?
118?
I believe that's it. 116. Sorry.
If you're doing the Warren collection, it's 116.
Sorry, it's 116.
So are you looking at 116?
I am, Your Honor.
I believe it's Defense 116.
No, that's what you're making.
Oh, you're right. You're right. It's 116. Sorry.
Which one do you want?
116. 116, Your Honor.
Your exhibit.
Correct.
All right.
116.
We're all on the same page.
Okay.
Your Honor, I would object.
What's your objection?
There are about, 50 or 60 photos on here, and he has not testified to more than 10 or 12 photos.
And your point?
We don't know what all of these are. There's no evidence about what all of these are, so they're just photos then going back to the jury.
So you're objecting based on relevance? He
And
testified
lack
those
of-
are photos that he took out of his report, right?
Correct, and so I think without testimony about each one, I think, on a relevance basis, I don't think we have a basis to show how they're helpful for the issues.
Well, there's been some allegation through Cross that the state selectively chose slides. I simply want to show that there's more to the story.
So the objection is overruled, it's admitted.
The defense also asked you about why you focused only on pinto beans. You talked about looking through various references, right?
Correct.
Let me ask you this. Is there any point in examining beans under a microscope when you can tell from looking at them that they're not the same structure of what you're seeing in the other Petri dish?
It's absolutely not need to do that.
Okay. So do you happen to have one of the books that you referenced?
I have several.
Okay. Could you pull one out maybe and show us how that works? How did you go about actually comparing what you saw to known pictures of different types of beans so that you could zero in on pinto beans?
Certainly. This is the manual that I believe defense counsel and I were both looking at. I believe they had a page from it. It's from the National Institute of Justice Research Report. It's entitled Identifying Plant Food Cells and Gastric Contents for Use in Forensic Examinations, a laboratory manual.
And does it have pictures of bean structures in it?
Yes, it does.
And when you were going through this case, did you look at each and every picture of beans in order to tell what you were working on so you could narrow it down to what you wanted to look under the microscope?
Yes, I did.
and what you found was pinto beans.
Correct.
That it?
That's it. Thank you.
Anything else, counsel? You may step down.
Thank you.
And any exhibit that you have that has a number on it should go back to the courtroom.
I have Exhibit 118.
Well, when he
Leave
gets
here.
it, you don't leave with that.
I will not leave.
The state calls Dr. Brian Mountain.
Come forward, sir. Would you raise your right hand and swear or affirm your testimony in this matter will be the truth, the whole truth, and nothing but the truth?
I do.
See.
Could you tell us your name and spell your first and last name, please?
Yes, my name is Dr. Brian Mazrum. That is Brian Mazrim.
And what is your occupation?
I am a forensic pathologist, one of the medical examiners here at the King County Medical Examiner's Office.
What does a forensic pathologist do?
A forensic pathologist determines the cause and manner of death of individuals who die in circumstances that fall under our jurisdiction, most typically by performing an autopsy exam.
Okay. And what kind of circumstances fall under the medical examiner's jurisdiction?
We are involved in any non-natural deaths, that is all accidents, suicides, and homicides. And we also become involved with cases in which an individual dies when they have no physician to complete a death certificate.
Could you tell us a little bit about your background and education that qualifies you for this position?
I went to medical school at the St. Louis University School of Medicine. I graduated with an MD in 1996. After that, I went on to complete a residency in both anatomic and clinical pathology, also at St. Louis University Medical Center. After my residency training, I went on to do an additional year of subspecialized training in forensic pathology at the Milwaukee County Medical Examiner's Office in Milwaukee, Wisconsin.
Okay. And how long have you been at the medical examiner's office?
Since 2001.
Can you tell us the difference between a coroner and a medical examiner?
Both are county physicians. They perform similar functions. A coroner is an elected position, whereas a medical examiner is an appointed position. Medical examiners are always physicians and will perform autopsies themselves to determine the cause and manner of death. Coroners are not necessarily physicians and will have a staff of pathologists to perform autopsies for them. In Washington, there are both coroners and medical examiners, depending on the county, and basically the larger counties, more populous counties have medical examiners, the smaller counties have coroners.
How many autopsies would you estimate you've done over the years?
I don't know an exact number, but over 3,000.
And when you talk about pathologists, what does that mean exactly?
A pathologist? Well, there are a lot of kinds of pathologists. They are physicians who work more in the laboratory side of medicine. So if somebody has a biopsy taken, it's a pathologist who looks at that under the microscope to try and make a diagnosis. They run the chemistry laboratory, the microbiology laboratory, things like that. They also perform autopsies in hospitals, or if they have training in forensics, they can perform autopsies at a medical examiner's office.
Okay. And an autopsy is to determine how somebody died.
Yes.
Do you also respond to the scenes of homicides?
Yes.
And why do you do that?
Two reasons. First, both to see the body at the scene can help us interpret any wounds that we see during our examination just by seeing things at the scene, whether it's blood spatters, patterns, or potential weapons, things like that. So it can help us in our investigations. And also, we do perform a preliminary examination of the body to try and answer any questions that the investigating police agency might have early on in the investigation.
Did you go to the scene when Nicole Pietz's body was found on?
Yes, I did.
What is your recollection of what you saw when you got there?
Well, the scene was the end of a street, sort of a small cul-de-sac in a forested area. And the police had been out there for some time before we arrived, so a path was cleared back to where the body was found. There were a lot of brambles, sticker bushes, and undergrowth in the area. And the body was simply lying there amidst all these brambles on her back with her legs flexed and her arms kind of over her body.
Did you examine her body at that point?
Briefly.
Can you describe sort of the weather and the ground conditions at that time?
Well, it was February. It was cold and wet. There was a lot of debris adherent to the body. She was unclothed. And just debris from the area, dirt, leaves, that sort of thing, vegetation, and the body was very wet.
Can you tell us about the condition of her body with regard to rigor mortis?
Rigor mortis had receded. It was the stiffening of the muscles that occurs after death. Lasts for a little while and then it fades again, and it had faded in this case.
How long does that take typically?
That is quite dependent on environmental factors, most notably temperature.
So if it's colder, would it take longer?
Yes, with a lot of the postmortem changes, in the cold they take longer to progress. So it might take a little bit longer for rigor mortis to fully develop and then a little bit longer for it to recede again.
Okay, and when you talk about a little bit longer, can you give us sort of a span of time? Are you able to do that?
Well, typically in sort of room temperature sort of conditions, you expect to see it fully established in roughly 24 hours or so, and then begin to fade after that and be gone by maybe 48 hours. And that's going to be extended by several days at least in colder weather.
What about lividity? Can you tell us what that is?
When an individual dies, obviously the heart stops beating, and the blood simply settles downwards towards gravity. Initially, that settling of the blood occurs within blood vessels. So an deceased individual lying on his or her back, the blood will sink and you'll see a purple discoloration form on that individual's back. Early on, within the first, say, day and a half after death, under, normal sort of room temperature conditions, that blood stays within blood vessels. So if the body is, say, turned onto the front, the blood will then shift to the front of the body. After a couple of days, the blood vessels begin to break down, the red blood cells themselves begin to break down, and the red pigment, the hemoglobin, begins to leak out of the blood vessels and into the surrounding tissues. At that point, the lividity is called fixed. It will no longer turn. So an individual who's laid on their back, deceased for a couple of days, when turned onto the front, the purple discoloration will stay on the back of the body.
And does it stay that way forever after?
Yes.
Okay. And what did you notice of the lividity of Nicole Pietz's body?
The lividity was on the back-sided surfaces of the body and was fixed.
With regard to skin slippage, can you tell us what that is and why it matters?
Skin slippage is one of the more advanced changes that occurs after death. And basically after death, all of the cells in our body begin to break down, and the junctions between cells begin to break down, and those junctions between cells are what holds the superficial layers of skin in place. So during the early phases of decomposition, the superficial layers of the skin become loosened. They're no longer firmly attached and will, if touched, slip free from the body, exposing the deeper surfaces of the skin.
Does weather and temperature affect the rate of decomposition?
Absolutely. Again, decomposition is going to proceed much more slowly in colder weather.
And are all these things together relevant when you're hoping to try to determine some range of time of death?
Yes.
Okay. How specific can you get with regard to when someone died, just based on the condition of a body?
There again, it depends a little bit on what stage of postmortem changes you're looking at. An individual who's died indoors and within, say, 2 days of death, you can get to within a few hours. But as you go out further, several days, when many of those early changes, like rigor mortis, have gone away, the variables just keep magnifying. So in an individual in the state of decomposition of Ms. Pietz, the best we can do is within 2, maybe 3 days.
Okay. And with regard to her, I'll show you a calendar. I'm showing you what's been admitted as Exhibit 13. Now, on this day, the 6th is when she was found.
Yes.
What is your what is your opinion as to how long she'd been dead?
I think we estimated somewhere in the neighborhood of a week, give or take, maybe 2 days.
Okay, plus or minus 2 days?
Yes.
Now, in your report, you indicate January 29th at 7 p.m. What is that specific? What is that?
Basically, on a death certificate, we have to.
Excuse me. Sorry, we were talking about the date listed in your report of January 29th at 7 p.m.
Mm-hmm.
That's an awfully specific date and time. Where does that come from?
That comes from our computer database. Basically, we have to basically fill in a form for the death certificate that has a date and time. It's simply a requirement of completing it. And sometimes we'll do when they were last known alive. Sometimes we will use a date and time of when they were reported missing, something like that. And I don't recall exactly in this case which that date and time refers to.
Okay. I want to ask you this. Your estimate of time of death, given that it's a week plus or minus February 6th, is that consistent with the time period of January 27th through the 28th?
Yes, it is.
So what protocols are followed when a body is recovered outdoors if it's a suspected homicide?
I guess the first protocol that would be different from a different sort of a non-homicide, a non-suspicious sort of case would be that the pathologist is called to the scene where, as we already discussed, we perform a preliminary examination. At the scene, we begin to do a few things to help preserve any trace evidence. We'll put paper bags over the hands, secure them in place. The body is wrapped in a sheet to help retain any trace evidence that might be adherent to the body. The body is sealed in a body bag with an integrity seal to prove that nobody's had access to the body between the time when we place her in the body bag at the scene and then proceed with our autopsy examination back at the office. That said, once at the office, a homicide investigation requires both more documentation and more evidence collection than other sorts of cases. The evidence collection would be swabs routinely taken for potential trace evidence like DNA that might be adherent to the body. We will recover fingernails, samples like that. We perform a sexual assault exam, and any other trace evidence that we happen to see when we're performing our examination. As far as documentation, photographs are routinely taken in every case, but more photographs, more detailed photographs are taken in homicide investigations. A body diagram is created by the pathologist to document injuries, and then finally a report is produced.
Okay. And so was Ms. Pietz autopsied at the medical examiner's office?
Yes.
And how was she officially identified?
I believe I saw in the database earlier that there were two methods. One was via tattoos, so kind of a visual ID, but in homicides we also like to confirm that with a scientific method, and I believe that was accomplished by dental x-rays.
She had a tattoo on her lower back.
Yes.
And did you participate in the autopsy?
I supervised our fellow, that is a physician who's completed his residency in pathology and is doing that subspecialized training in forensics.
Before the autopsy, was she weighed and measured?
Yes.
And what were her height and weight?
Height was 5 feet 3 inches. Weight was 124 pounds.
I have just one. Was she wearing any jewelry?
Yes, she was.
What was she wearing?
There was a white metal chain with a cross pendant that had embedded clear stones in place around the neck. There was a piercing in the belly button that had a white metal stud with a clear stone in place. And there was a single earring in the left ear, yellow metal with a clear stone.
I'm sorry, couldn't hear that?
The earring was in the left ear, described as yellow metal with a clear stone.
Did you find anything in her mouth?
In her mouth?
Yes.
She had a clear plastic dental device in place in the upper jaw.
Okay. I'd like to show you what's been marked State's Exhibit 121, and let me just quickly look through it. Are those photographs that were taken when she arrived at the office and during the autopsy?
Yes.
And would those illustrate what you're going to be testifying to with regard to injuries and other issues related to the autopsy?
Yes.
Offer 121.
Your Honor, we stand on our previous suggestion.
Let me see which one's going to accept that.
May I ask you a question for 1 second?
Hey, Dr.
Excuse me, Your Honor. Could I have that exhibit number again, please?
121.
Thank you.
Dr. Meldrum, I'm going to show you a photo that's been marked A. It's a little hard to get bearings, but is this a close-up of her mouth?
Yes, looking sort of at the left side of
Okay, so this part is what?
the,
Teeth?
the lower jaw.
And this is the upper teeth?
Yes.
And there appears to be an object in there. Is that the dental device you were referencing?
Yes.
Did you take swabs from her neck area during the autopsy?
Yes, we would have. That is a routine part of the evidence collection.
And what is the purpose of that?
Looking for trace evidence, specifically in the form of DNA, typically.
Have you had success with that in the past?
Yes, we have.
Are there factors that might limit the possibility of success of getting DNA, particularly environmental factors?
Well, certainly in this case, yes, the changes occurring after death with being in an obviously wet environment for some period of time would potentially wash away trace evidence.
States Exhibit 122.
Thank you. I'm going to hand you what's been marked States Exhibit 122. Can I get some gloves from the clerk, please? Thank you. I think it's packaged, but just didn't have any. First of all, would you take a look at it? There seems to be an ME number on it. What does that mean?
Well, it's labeled with our evidence tag, so with her medical examiner's number and a description of what's inside.
Okay. And who would have done that?
This would be completed by the autopsy staff.
Okay. Once the evidence has been taken at autopsy, what happens to it? Is it sealed up there or given to someone? What happens to it when you take it off the body?
It is packaged, sealed at the medical examiner's office, and then released to the investigating police agency.
In looking at that package, are you able to tell that it did come from the medical examiner's office?
Yes, it does have our label in place.
Okay. Is that 121, sir?
122 if this is the
Thank
number.
you. I'd offer 122.
No objection.
Admitted.
Okay, could you go ahead and open that, if you would, please, with the scissors and remove what's inside? And what does that appear to be?
A plastic dental device.
And is that the one that was taken off Nicole Pietz's body from inside her mouth?
Yes, it is.
Okay. Since he's gloved up, may I have Dr. Mazurn publish it to the jury? Okay, could you please come forward and just hold it up and slowly walk it down the jury, if you would, so they can see it? you can use in your seat.
State's Exhibit 123.
And you look for State's Exhibit 123. Could you again look for the medical examiner's tag and indicate if that's something that was taken off Nicole Pietz's body at the time of the autopsy?
Yes, it's inside additional packaging, but the medical examiner's tag is here, yes.
Okay, offer 123.
No objection.
Could you go ahead and open that, please? Okay, and you can open the interior. You just examine the item. And what is that?
This is the necklace described previously with a cross pendant.
You don't have to put it on the chain. You can just hold up the cross separately. if you
I'm
would.
sorry, I can't hear you.
I'm sorry. I was just telling Dr. Masrum he doesn't need to put the cross on the chain. He can just hold them up separately.
Okay. Would you like?
Sure. Or just if you can just hold them up, that's fine. No need to walk them down. Okay. Okay. Thank you. You can put it back in. Was there an indication of any other jewelry found on her body, for example, a bracelet?
I do not see a bracelet listed in the autopsy report, no.
Did you find indicators of food in her stomach?
Yes.
And how were you able to tell that?
Well, as part of the autopsy examination, when we are examining the organs from the body, amongst those, we examine the stomach, and we simply open the stomach and find what's inside.
And in your opinion, based on your experience and training, how long does it take for a full meal to be digested out of the stomach and into the intestine?
That's a kind of a complicated question. It's a variable process depending on both the size of the meal and what that meal consisted of. Most notably, I think, how much fat is in the meal. That takes longer to digest. However, roughly, just an average size meal, not a particularly large meal, might be expected to be emptied from the stomach in 2 hours, maybe more, maybe 4 hours.
Okay, and then a larger meal, what would be the outside limit, would you say?
I don't know what the very outside limit would be. Again, there's a lot of factors with GI motility and again, a large meal, but it could be, I don't know, 6 to 8 hours even, potentially for a large fatty meal.
Did you find anything else in her stomach of note?
Along with just partially digested food, there were 4 pills on which was written Asacol, A-S-A-C-O-L.
I'm showing you part of what's been marked and admitted as Stacy Exhibit 64. The fact that the pills had writing on them, was that significant to you in some way, given that they were in the stomach?
That would give some indication of how long they've been in the stomach. The specific time would have to be done with testing on the pills, I would think, because there's different sorts of pills out there. Some are made to stay intact longer, extended release sorts of things, whereas others are made to break down quickly, so they're absorbed quickly. And I don't know the specifics with this drug, but it would give some indication, at least be one part of that investigation as to how long they've been in the stomach.
Okay, because the writing would indicate to you it hadn't started to break down yet.
Correct.
So what happened to the contents of her stomach?
A sample of that, at any rate, is maintained at the medical examiner's office, frozen.
Okay. So why is it frozen?
Just to keep it intact for a longer period of time.
And then at some point it can be sent on for testing at the lab? Is
Yes.
that the theory?
Yes.
Okay. I'm going to show you a picture that's been marked B. What do you see when you see that hand that was significant to you?
What you see here is obviously the left hand, but with very thickened, pale, wrinkly skin. And this is typical of a body that's been wet or even submerged in water for a period of time.
Okay. Is that sort of like when you stay in the bathtub too long?
Exactly the same thing.
Okay. And what parts of the body do you find that sort of pruning effect?
You really only see that on the hands and the feet.
And when you went through, let's say, the outside of the body, let's go through that first. Give me an overview of what you found.
State's Exhibit 124.
Doctor, I'm showing you what's been marked at State's Exhibit 124. Is this the standard anatomical diagram used by the medical examiner's office?
Yes, it is.
Would this assist you in helping us document the injuries to Nicole's body?
Yes.
Offer 124.
Well, Your Honor, there's nothing written on it yet. I don't have an objection to the doctor using it.
He will be writing on it.
Writing on it.
Then I would have no objection for illustrative purposes only.
Illustrative purposes.
Were there some injuries or defects on her body that you could attribute to the fact that she had been outside for a period of time?
Yes, there were some postmortem changes.
Okay. I'd like to discuss only those injuries that were not the results of being outdoors or animal activity, or things that appeared to you to be due to decomposition. Okay? With regard to her face, with regard to just the injuries that were visible on the outside, I'm going to ask you to step down to the diagram if you would. And could you tell us where they're, I'm going to have you stand over here. If you would, so the jury can see.
You're going to have to keep your voice up, Counsel.
I'm sorry. Were there injuries to the outside of her face?
Yes.
Okay. Could you show us, first of all, tell us what they were and where they appeared?
Your, counsel, can you please explain or let me know, are we talking pre-mortem or post-mortem at this point injuries? Or was that not asked?
It's not been asked yet.
Oh, okay,
Don't
sorry.
worry.
Okay, thank you.
The first thing would be a small bruise, about a half an inch or so, on the right cheek, roughly here.
Then how about on the left cheek?
On the left cheek, there was another slightly smaller contusion or bruise, roughly here.
And what causes bruising?
Bruising is a blunt force injury, that is a blow from a blunt object.
And can you tell if this force came before someone died?
Yes, bruises occur before an individual dies. You have to have blood pressure to create a bruise, and blood pressure is lost at death.
With regard to her neck, again, just what was visible outside for now. Okay, and I'm going to show you slide C. Did you see anything of note on the neck?
Yes, there is, as depicted here in the photograph, and that would be roughly here on the diagram. There was another contusion or bruise.
How can you tell the difference between bruises and lividity, since they're both sort of red on the skin?
Well, when you look inside, you can see a collection of blood in a bruise, and it's more, in lividity, it's more diffusely spread out throughout the tissues, whereas in a contusion, it's an isolated, well-defined collection of blood. And then, of course, if the majority of the lividity is on the back of the body and you see a red spot on the front, that might make you think this is more likely a contusion than lividity.
Okay, so do you have any doubts if that's a bruise?
No.
Now, were there also what appeared to be scratches on different parts of the body?
Yes.
Having been out to the scene, do you have an opinion as to what those might have been due to?
Well, these were clusters of parallel superficial abrasions or scrapes, well-defined, on sort of the prominences of the body. Here, this is demonstrated, I think, on the abdomen.
That's like D, just for the record.
You can see this cluster of linear scrapes without any sort of vital reaction, without any bleeding or scabbing or redness or anything like that. Very likely these occurred after death, and very likely occurred as the body was taken through all these sticker bushes.
Or would it also be consistent with being pushed under a blackberry bush or some other bush with thorns on it?
Yes.
Now, can you just, let's change colors on the diagram, if you would just indicate in black on the diagram where those types of scratches were seen on the body.
There were two such scratches on the right cheek, roughly here. There was a cluster on the front of the body extending from the breasts to the lower abdomen. So roughly here. There was a cluster on the side of the thigh, roughly here, and a few on the back, roughly here and here.
Now, if we move to the arm and hand, showing you slide E, what does that depict?
This is the right arm, sort of the inside of the elbow, and you can see a bruise just there on the inside of the elbow.
Okay, now, you talked about blunt force trauma. What does that mean that causes a bruise?
Well, it's non-specific. Any blunt object, something that's not sharp, striking the body or the body striking a blunt object can cause a bruise.
Could that be a hand?
Yes, it could be a hand.
Okay, and where would that show up on the diagram?
That would be...
Here, let me give you the red again, please.
roughly here.
Now, obviously, on the diagram, you're not drawing to scale, correct?
Correct.
Showing you slide F. What does that appear to be?
This is the back of the left hand, again showing a bruise.
Okay, and so could you mark that on the diagram?
Yes.
And slide G.
This would be the right thigh, sort of the outside of the right thigh, knees obviously here, and a purple bruise.
Okay, and could you mark that on the diagram? Now that sort of peeling of skin, is that the skin slippage you were talking about?
Yes.
And was there a corresponding bruise on the left thigh?
Yes, there was.
Could you mark that on the diagram? And anywhere else on the leg, on a knee?
Yeah, on the front of the right knee there was a bruise. On the shin or calf here, and on the top of the right foot as well.
And was there a bruise on the other foot?
Yes, there was. And sounds like also a contusion on the left shin as well.
Okay, showing you slide H. What is that? Can you orient us?
Yeah, so this is the right hip, the belly here, and the legs going down. And you can see this slight rise here. This is the hip bone, the iliac crest. So this is just over the pelvis, that bony part of the pelvis, the iliac crest. Another bruise.
Okay, could you mark that on the diagram?
Yes.
And was there a corresponding bruise on the other side?
Yes, this is a photograph of the other side. And again, a bruise here. You can see again the iliac crest passing this way, so overlying the front end of that, roughly here.
Okay, with regard to internal injuries, let's start with her back. Did you find anything in the back?
There were some deep muscular hemorrhages.
What does that mean?
Deep bruises, essentially, in the muscles of the back and in the muscles of the neck, just to the sides of the spine.
Okay, could you draw those on the diagram?
Roughly here, lower back, and in the neck, there are hemorrhages on both sides of the spine, roughly here.
Okay. And was there a speculum examination of the vagina then as well?
Yes, there was.
And was there any injury inside?
There was a very small 0.2 inch, so less than a quarter of an inch, laceration just on the entrance of the vagina.
Now, inside the neck, I'm going to have you stay standing if you would, but I need to grab something over here.
State's exhibits 125 and 126 have been marked.
Hey, doctor, these are not in evidence yet, so I need you to look at them over here, please.
So those just anatomical
They are,
medical joints.
yes.
I assume you have no objection to those, counsel, for illustrative purposes.
No objection.
Okay,
I assume he's going to draw them.
yes. Okay, 120, let's start with 120. Would it be helpful to look at these?
125.
Sorry, I know, I'm deciding. Sorry. Would it be helpful to look at these together, or should we do them individually?
I
Oh, for the record, one
120.
neck and one's what?
One is the lateral view, and one is the anterior view. So it
And
shows
the
the
anterior is 125 or 126.
anterior is 126, lateral is 125.
I think most of the hemorrhages anyway would be demonstrated on the anterior view, 126.
Okay, let's start with that one then. So can you tell us just a little bit about the musculature of the neck in general?
Well, this is a diagram of what are called collectively the strap muscles of the neck. These are fairly thin-bellied muscles, you know, less than a quarter of an inch, many of them less than an eighth of an inch thick, that are used in supporting the head, turning the head, nodding, and swallowing.
And when you talk about hemorrhages on them, how does that work exactly? Where is the bleeding coming from?
Is he in the way?
Oh.
Could you stand to the side, please?
Beg your pardon.
Where is the
I want the
bleeding?
hand in my pointer,
Okay.
because it will work on that. When you stand aside and give us the pointer. Various items on your time today.
Thank you.
Without obstructing the view of the jury.
Just don't point it at the jury.
Okay.
You don't point that in everybody's eyes, you know that.
Okay.
Bird airplanes either, Your Honor.
Don't point it at the airplane.
Could you tell us a little bit about, when you talk about hemorrhaging in the muscles, what do you mean exactly?
Well, these are blunt force injuries in the musculature of the neck, which raise the concern, typically, kind of the classical concern for a strangulation.
And how many did you see in the neck?
Listed are 8 separate areas of hemorrhage within the strap muscles.
Okay. Are you able to draw those on that diagram? No, I would suggest using the black since the diagram is red. And is it a little difficult when you're talking internal injuries to mark it on a diagram?
Well, a little bit. We're all proportioned slightly differently, so they may not be, you know, proportioned exactly the same and provide the same pattern overall, but to give at least some idea of where the hemorrhages are.
Okay. So go ahead and just tell us as you're doing it, please.
Okay.
Actually, why don't I have you do this since we don't want you blocking the diagram? Why don't you draw them in and then I'll have you walk through them. How about that?
Okay. I suppose one difficulty in trying to draw them out is that the strap muscles are present in various layers in the neck. So there'll be a hemorrhage on the one closest to the skin, and then a hemorrhage underneath it, and the next layer down. So it's a little bit difficult to draw exactly where they are, but I can at least diagram on here
Okay.
where they would be regardless of what level they're on.
Then what we're gonna do,
No break?
we're gonna take a break. You can spend as much time as he wants to break drawing on that diagram. And explain it out. Doctor, you may proceed. Go ahead. If you wanted, you could try. You can just pick which ones are interior where you wouldn't go see me. I was thinking you draw a circle around the outside of it. It's one that's buried, just to indicate those that are buried versus those that are surface.
Okay, I'll try
That
that.
makes sense.
Thank you.